You're listening to Med School Radio. Hello everyone, welcome back to Med School Radio. We are back again and we're going to be looking at hypophosphatemia. Have you ever thought about that? What is hypophosphatemia? Well, we are going to be looking at Wikipedia and we're going to try to get a basic understanding of what it is. So we have the introduction, some signs and symptoms, causes, pathophysiology, diagnosis, and treatment. Let's just touch on these and see if we can get to some idea of what's going on. So firstly, it is an electrolyte disorder in which there is a low level of phosphate in the blood. Signs and symptoms may include weakness, trouble breathing, and loss of appetite. Complications may include seizures, coma, rhabdomyolysis, or softening of the bones. And the causes could be alcoholism, refeeding in those with malnutrition, diabetic ketoacidosis, burns, hyperventilation, and certain medications. It may also occur in the setting of hyperparathyroidism, hypothyroidism, and Cushing's syndrome. It is diagnosed based on a blood phosphate concentration of less than 0.81 millimoles per liter, and when levels are below 0.32, it is deemed to be severe. And treatment depends on the underlying cause. Phosphate may be given by mouth or by injection into a vein. Hypophosphatemia occurs in about 2% of people within the hospital and 70% of people in the intensive care unit. That's a lot. So that was a summary here. So you can look at more detail if you go to wikipedia.com. Wikipedia.org. So let's just summarize this again. So a synonym here would be low blood phosphate. This is in the specialty of endocrinology. The symptoms: weakness, trouble breathing, loss of appetite. Complications: seizures, coma, rhabdomyolysis, softening of the bones. Causes: alcoholism, refeeding in those with malnutrition, hyperventilation, diabetic ketoacidosis, burns, certain medications. And the diagnostic method is to look at the blood phosphate. If it's less than 0.81, you're in trouble. And the treatment is based on the underlying cause. So you give phosphate. Let me just look at that again. I'm interested in the treatment. It says, standard intravenous preparations of potassium phosphate are available and are routinely used in malnourished patients and alcoholics. Oral supplementation is also useful where no intravenous treatment are available. Historically, one of the first demonstrations of this was in concentration camp victims who died soon after being refed. It was observed that those given milk, which is high in phosphate, had a higher survival rate than those who did not get milk. Okay, so there we have a basic introduction of hypophosphatemia from looking at wikipedia.org. Thanks for tuning in, and please join me again.